everyone. Welcome back to all my listeners. This is episode 18 in season 14. Today is Wednesday, April 30th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys. So as you know, it's the last day of the month, and of course, it's going to be my biggest episode for the month of April because it's going to be featuring my fraud, waste, and abuse highlights for the entire month of April. And of course, I'm going to be spotlighting some of those from the month's criminal and civil enforcement cases that I find newsworthy. And in my trusty tip, I'm going to go ahead and focus on something that ties in quite nicely to one of the big enforcement cases, urine drug tests. And I'm going to go ahead and close out and round out today's episode with another remarkable quote on change by Leo Buscaglia. All right, you guys, let's get into it. So in today's Newsworthy, I'm going to be featuring the month's fraud, waste, and abuse cases like I do month after month. Now, the month of April saw a whopping 55 cases as of the recording of this episode. So let's go ahead and check out some of the cases in the spotlight. Early April saw the United States filing a False Claims Act complaint against Vora Wound Physicians Management and its owner, alleging false claims for wound care services. The United States filed a complaint under the False Claims Act against Vora Wound Physicians Management, LLC, and its founder and majority owner, again by the same name, Dr. Vora, for allegedly causing the submission of false claims to Medicare for overbilled and medically unnecessary wound care services. Dr. Vora is one of the nation's largest specialty wound care providers and contracts with hundreds of nursing homes and skilled nursing facilities throughout the country to provide wound care services to those facilities patients need at their bedside. Now, according to the United States complaint, Vora and Dr. Vora knowingly engaged in a nationwide scheme to falsely bill Medicare for surgical debridement procedures to maximize revenue. Debridement is a procedure to remove impediments to healing from a wound, such as dead or unhealthy tissue, and can be accomplished in several ways, including non-surgical and surgical methods. The complaint alleges that the defendants pursued their fraudulent scheme in three primary ways. First, Vora created a proprietary electronic medical record, or EMR software, that was programmed to bill debridements as surgical procedures even when they were not. Second, Vora hired physicians without wound care expertise and provided training that omitted relevant Medicare payment rules and intentionally conflated the definitions of surgical and non-surgical debridement procedures. Third, Vora set corporate debridement targets based solely on revenue goals and pressured its physicians to meet those targets. As a result, Vora allegedly caused the submission of claims for surgical debridement services that were not medically necessary and used billing codes that represented more complex procedures than were actually performed, a term commonly referred to as upcoding. The complaint also alleges that the defendants programmed Vora's proprietary EMR software to improperly apply the Modifier 25 billing code and charge Medicare for exams that were not separately billable from surgical debridement procedures performed on the same day. Because surgical debridements are billed as global surgical packages and include payment for an examination, evaluation and management, or E&M service, those services are only payable on the same day if significant service is performed that is separately identifiable from the surgical debridement as signified by Modifier 25. According to the United States complaint, Vora's proprietary EMR software automatically added Modifier 25 to its E&M claims without regard to whether the modifier was appropriate and thereby causing the submission of claims for E&M services that were not payable. Now, the claims asserted in the government's complaint are allegations only, and there has been no determination of liability. All right, now early April also saw a Greensboro woman pleading guilty to healthcare fraud and money laundering in connection with multi-million-dollar urine drug testing schemes. Now, she pled guilty to 1 count of healthcare fraud and 1 count of money laundering in connection with a scheme to fraudulently bill the North Carolina Medicaid program for millions of dollars of urine drug tests and office visits that were not performed. Now, according to court documents, the woman owned and operated 2 businesses located in Winston-Salem, North Carolina, and they were called Harvest Focused and Consulting Services, LLC, and The Ultimate Sacrifice. Both of these businesses billed Medicaid for services that were not performed, including significant quantities of urine drug tests. For example, on 97 occasions between August 2020 and July 2022, Harvest Focused submitted claims to Medicaid for urine drug tests for a Medicaid beneficiary who had never heard of Harvest Focused or The Ultimate Sacrifice, and they never received services from those companies, and they did not provide any urine for urine drug testing. Over the course of the scheme, Medicaid reimbursed Harvest Focused and The Ultimate Sacrifice over $6 million. She used the fraudulently obtained proceeds on personal expenses, including the purchase of a Dodge Challenger. Sentencing is scheduled to take place on July 31st, 2025. She faces a maximum sentence of 10 years in prison, a period of supervised release of up to 3 years, and monetary penalties. Now, early April also saw a Minnesota couple indicted in a $15 million medical billing fraud scheme. Now, an indictment was just unsealed, alleging that a Minnesota couple engaged in a $15 million scheme to defraud Medicare, Medicaid, and other insurers by overbilling for neurofeedback therapy. Now, according to court documents, beginning in 2018, the couple intentionally devised and carried out a scheme to overbill Medicare, Medicaid, and other insurers for medical services provided through Golden Victory Medical LLC, or GVM. Now, the pair were in a relationship and together founded GVM in 2018. According to court documents, one of the main medical services GVM claimed to provide was neurofeedback therapy. Now, during neurofeedback therapy, a medical provider places sensors on a patient's scalp to obtain images of the patient's brain waves for the purpose of indicating the effects of interventions meant to treat mental health conditions. But according to this indictment, the couple fraudulently overbilled insurers for GVM's neurofeedback services using numerous inapplicable medical codes. For example, GVM repeatedly submitted claims to insurers using medical codes that did not cover the neurofeedback services for that GVM provided, combinations of codes that by definition could not be combined, and codes that indicated that GVM's patients received a longer duration of services than the company had actually provided. The pair caused GVM to continue submitting false claims even after repeated warnings from insurers, an outside auditor, and the Center for Medicare and Medicaid Services. Now, in total, GVM submitted hundreds of thousands of false claims to insurers, many of which the insurers paid, resulting in an estimated loss of over $15 million. Millions of dollars in fraudulent proceeds were transferred from bank account to bank account and ultimately retained by the duo. They used the funds to purchase a mansion in Eden Prairie, Minnesota, and to pay their living expenses and the living expenses of other girlfriends who lived with the couple and assisted in the fraud scheme. Now, the couple are each charged with 6 counts of wire fraud and 1 count of money laundering. Now, an indictment is merely an allegation, and the defendants are presumed innocent until proven guilty beyond a reasonable doubt in a court of law. Now, mid-April saw a North Ridgeville, Ohio doctor pleading guilty to healthcare fraud conspiracy. Now, an Ohio doctor has pleaded guilty to his role in a conspiracy that prescribed medical equipment and lab tests for patients who did not need them, and then submitted those claims to Medicare to receive payment. According to court documents, the man admitted that he and other co-conspirators engaged in a scheme to fraudulently bill more than $14.5 million in payments for Medicare. He was employed by two telemedicine companies, Real-Time Physicians LLC, based in the state of Nevada, and 24-Hour Virtual MD LLC, based in the state of Florida. Now, the companies provided him with pre-completed orders for durable medical equipment, or DME, such as braces and or cancer genetic testing, for him to approve and then digitally sign. In doing so, he affirmed that he had examined patients using a telemedicine platform and determined that they needed DME or those cancer genetic tests were necessary. But in truth, he never examined any of the patients who resided throughout Ohio and Florida. Now, once he prescribed the equipment or ordering testing, Real-Time Physicians and 24-Hour Virtual MD furthered the conspiracy by forwarding the orders to companies under their control or sold the orders to other medical entities to provide DME or conduct the laboratory testing. He defrauded Medicare by submitting claims that were not reasonable and not necessary for medical treatment and did not comply with Medicare rules and regulations or applicable federal laws. On April 4th, 2025, he pleaded guilty to attempt and conspiracy to commit wire fraud and bank fraud, false statements related to healthcare matters, and aggravated identity theft. He faces a maximum penalty of 27 years in prison. Sentencing is scheduled for July 26, 2025. A federal district court judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. Moving on, mid-April also saw a Dayton woman gets prison for a $1.5 million theft from a Medicaid program. A woman banned previously from working as a Medicaid provider was sentenced to 6 to 9 years in prison for yet again defrauding the program, this time stealing $1.5 million. She pleaded guilty on March 17th to second-degree felony theft and 3 third-degree felony counts of identity fraud. Besides the prison sentence, she must pay $1.5 million in restitution. She was indicted in May 2024 after an investigation revealed that she stole multiple identities to open and operate 2 sham behavioral health counseling agencies in the Dayton, Ohio area. She also stole the identities of several licensed counselors, using their credentials to bill Medicaid for services that were never provided. Authorities arrested her in August of 2024 at a bus stop in Dallas, Texas, after she fled the state of Ohio and then spent months on the run. A previous theft conviction in 2019 had barred her from the Medicaid program. Now, mid-April also saw an executive vice president of insurance brokerage pleading guilty in a $133 million Affordable Care Act fraud scheme. Now, this Florida executive pleaded guilty for his role in a scheme to submit fraudulent applications to enroll consumers in Affordable Care Act insurance plans, or ACA plans, that were fully subsidized by the government. The purpose of the scheme was to obtain millions of dollars in commission payments from the insurance company that operated the ACA plans. The federal government paid at least $133 million in subsidies for fraudulently enrolled individuals. Now, according to court documents, an executive vice president of an insurance brokerage firm, he participated in a scheme to fraudulently enroll ineligible individuals into ACA plans that offered tax credits to eligible enrollees. These tax credits or subsidies could be paid by the federal government directly to insurance plans as a payment toward the plan's monthly premium. The scheme involved submitting false and fraudulent applications for individuals whose income did not meet the minimum requirements to be eligible for the subsidies. The executive and his accomplices deceptively marketed subsidized ACA plans to ineligible consumers and falsely inflated consumers' incomes to obtain the federal subsidies. In furtherance of the scheme, he and his accomplices targeted vulnerable, low-income individuals experiencing homelessness, unemployment, and mental health and substance abuse disorders, and knew that street marketers working on their behalf offered bribes to induce those individuals to enroll in subsidized ACA plans. Marketers working for his accomplices coached consumers on how to respond to application questions to maximize the subsidy amount paid by the federal government and provided addresses and social security numbers that did not match the consumers purportedly applying. Now, he pleaded guilty to 1 count of major fraud against the United States and faces a maximum penalty of 10 years in prison. A federal district court judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. Now, an indictment is merely an allegation. All defendants are presumed innocent until proven guilty beyond a reasonable doubt in a court of law. Now we can move on. Late April saw an owner of a pharmaceutical company pleading guilty to unlawful distribution of a $60 million in diversions of HIV drugs. Now, this man pleaded guilty in connection with his role in a nationwide scheme to unlawfully distribute misbranded and adulterated HIV drugs to unsuspecting patients. Now, according to court documents, he was a part owner of Safe Chain Solutions, LLC, or Safe Chain, a wholesale distributor of pharmaceuticals based in Cambridge, Maryland, that purported to sell legitimate prescription drugs to pharmacies throughout the country, including expensive HIV medication. Now, in connection with his guilty plea, he admitted that he and his co-conspirators illegally acquired HIV drugs that had been diverted from the regulated pharmaceutical distribution chain by various means. One common method of prescription drug diversion involved buying bottles of supposed prescription HIV medication from individuals on the street, repackaging and relabeling the bottles, and then reselling the drugs to Safe Chain at steeply discounted prices with falsified documentation concealing the drug's true origin. Now, the man and his co-conspirators were notified of the false documentation accompanying these drugs, but continued purchasing the steeply discounted HIV drugs and reselling them to pharmacy customers, which dispensed the diverted drugs to unsuspecting patients. Now, according to court documents, at times patients received bottles labeled as their prescription medication, but which contained a different drug entirely, with one patient passing out and remaining unconscious for 24 hours after taking an antipsychotic drug, thinking it was his prescribed HIV medication. And now it's time for my best practice tips in Trusty Tip. All right, you guys, so that was a pretty whopping fraud, waste, and abuse newsworthy segment, wasn't it? This was a huge month of 55 cases at the time of recording. And one of the big items that really stuck out to me is something that I see in the everyday work I've been doing for a number of months now, even years. And that comes to urine drug tests, right? Just like that case that I put the spotlight on. So I know we've gone over this in a podcast episode in years past regarding a comparative billing report, or a CBR, on urinalysis. Urinalysis, same thing. It's called a drug test. It's called a drug screen. It's called a urinalysis. These terms are interchangeable. Regardless, it is used for the testing and the screenings of a variety of highly addictive drugs. And in these types of patient populations, it can happen in a pain management type of a situation. It can happen in a behavioral health type of a situation. It can happen in your everyday workplace type of a situation. There are many, many needs for a drug test, a drug screen on people's urine. So I know we've gone over this in years past, again, on that CBR in an earlier season, but it's clear to me in the documentation deficiencies that I see, there's so much room for improvement. Because there's so much room for abuse and fraud if things are not done properly, which we just went over in the Newsworthy segment. So what I still see missing when providers or labs are billing out these types of urine drug tests So to order a urine drug screen, a UDS, or it's called a UDT for the urine drug test, a physician or an administrator of a program requiring drug testing needs to place the order, right? You have to have an order for these types of treatments. So that order can be performed by doctors, program administrators, other types of healthcare qualified professionals. They are required to do so because, again, a patient is coming in and it's a requirement based on either some sort of illegality, or it's a part of their employment, or again, it's for some sort of substance abuse that was identified in their medical treatment and management in some sort of a addiction treatment facility or in a behavioral health practice, etc. So many needs for this type of testing or screening or analysis, right? Specifically on the substance of urine. Now, ordering a UDS typically involves these steps. You have to have a physician's order. So when I'm auditing these types of services in a pre-payment situation or even a post-payment type of situation, as a qualified auditor, I am looking for that very important document called the physician's order. And it's going to have to tell me that the physician ordered it, or some other qualified healthcare provider ordered it with the authority to do so, right? Based on their state statutes. Another important thing is you need to cross-check those state codes as well. For example, in the state of Illinois versus what do they say in the state of Ohio, right? There may be very nuanced details that you have to pay attention to. So you have to have that cross-check of something called the order. In that order, they're going to be specifying what test they want done or what test they themselves will be performing, right? If they happen to be a provider's office that obtained the appropriate levels of certification with a CLIA waiver or an even higher type of certificate of compliance to go ahead and test for those higher level of drug testings. So we should be specifying what the test is. It should specify the type of urine drug screen needed, including the specific drugs that are going to be analyzed, right? And what types of drug classes will be screened. Also, documentation is going to include that physician needs to document the reason for ordering that urine drug test, right? There has to be a reason, like I stated, for employment purposes, for legal purposes, for the substance abuse treatment program, addiction management type of purposes. All of that needs to be spelled out in documentation inside of the medical record. And that, therefore, will justify the overarching medical necessity for almost every single commercial payer, and most certainly for the government payers as well. That overarching need for medical necessity. Now, also, there's going to be different state laws that require various documentation on the sample collection, right? Was there a witness overseeing how that urine was collected, right? Was it tampered with, or was everything collected copacetically, right? So that sample collection is going to also vary from state to state. So that has to be included in documentation. So the patient also might have to be sent to a specific designated collection site, right? Where that person or team of people will be watching, right? Make sure that that collection is a clean collection. And then also the lab analysis, right? We're going to have to be looking if it's sent over to a certified clinical independent laboratory. That laboratory is going to have a report or a formalized analysis of what they performed, right? So a certified laboratory analysis is going to include screening tests that are highly complex, right? Like something known as the enzyme-linked immunoassay or the EIA to identify the presence of specific substances, again, that were ordered by the physician, right? So these types of labs cannot just have that free-for-all and start analyzing for things that are much, higher in terms of reimbursement amounts, right? If they start just billing for things that are much, much higher. Again, it's not ordered by the physician. This is how we get into the newsworthy portions of my monthly fraud, waste, and abuse segments, right? There's a lot of room for that type of abuse and fraud to actually happen. And then, of course, those results and then the interpretation, right, have to be printed out by the laboratory. So the laboratory is going to be providing those results to the ordering physician or the designated individual for review. And again, their interpretation, make a plan for the continued medical management of their patient based on those results, right? And then finally, there's also something known as that confirmatory testing, right? Yet the highest level of that CPT code or that HCPCS code, because you'll be analyzing many, many more levels through a higher, more analytical type of a process, often called chromatography mass spectrometry, right? That GCMS type of tool is going to be used when you are providing that confirmatory test. So again, that will be ordered as well after the screening test on the urine. There's something called a confirmatory test. Sometimes those two things go hand in hand. Sometimes they do not. They are done on different dates of service. But again, it's all going to boil down to the various practices and facilities and what they are using these urine drug tests for. So again, these confirmatory tests are going to be ordered to confirm the presence of the substances and their specific concentrations, again, to help those providers in medically managing their patient populations. So I hope this trusty tip is really helpful to those providers out there that are ordering urine drug screens and confirmatory drug tests on their patient populations, because there's so much that is still lacking in documentation that I see come in my door. All right. And finally, I focus season 14 Spark on change. I want this 14th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone whose words provide us with insights and wisdom on change. So in this week's inspiring quote in Spark is from Leo Buscaglia. Change is the end result of all true learning. Absolutely true, right? This quote reminds us that education and continued learning are huge factors in change. Without learning, how can we strive to make change happen? Without education, how can we make a lasting impact? To show growth, to show change, to show adaptability. I'm happy Leo Buscaglia's spark still burns brightly and inspires so very many. All right, you guys, that wraps up today's episode, the very last episode on the very last day of the month. So let me know what you guys have on the horizon for the new month of May. That's just tomorrow. I know we've got so much going on for graduations, end of year celebrations. Do not forget that Mother's Day is the second Sunday in May. So I'm sure you have a lot to celebrate there as well. All right, you guys, I wish you all an amazing and very, very happy week ahead. Thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.